Chapter 4, the estrogen fix and your breasts. Let's talk about that. Breast cancer is on the rise. It significantly impacts women. We've had some very famous personalities bring it even further, more to the top of the media news conversation. Tell us a little bit about the connection and what can we do to protect our breasts?
The most important thing to realize, of course, estrogen affects the breast because, as we talked about earlier, breast development, you go from basically looking like a boy's chest to being a voluptuous woman because of estrogen. So estrogen is causing breast development. The lobules and the glands of the breast are all developing, and that's all a result of hormones. But if you want to take estrogen and take it safely, the way to do that and accomplish that, as we were talking about a little bit earlier, is to start taking it close to the time of menopause. This is called the estrogen window, and I call it the estrogen window. And as a result of doing that, you don't have the break in constant exposure of the breast to estrogen. And if you take estrogen only, you lower your risk of breast cancer by taking estrogen. If you take estrogen and progesterone together, which is necessary if you have a uterus, then the risk is minimal, if any, and basically a kind of a no difference. The other thing to think about, of course, is what do women do who have had breast cancer? Mm-hmm. This is a very complicated thing, and I won't go into what's controversial here. I want to keep it very simple. So what I want to say is there are two forms of estrogen in terms of generally. There's the estrogen that goes to your whole body, and there's the estrogen that goes into the vagina locally. Estrogen that goes into the vagina locally can be taken even if you have estrogen receptor positive breast cancer. This is very important. One of the biggest complaints right now that I see for women with breast cancer is they are struggling with vaginal dryness, with painful sex, and they are really in a bad place with this very important part of intimacy. Many times women have lost their breasts. Mm-hmm. They don't feel as pretty, perhaps, some of the time. They want to be able to feel close, and intimacy is a very important part of that. And if you then take away any pleasure with sex because of lack of estrogen, that's a real shame. And this opinion piece that came out from the American College of Obstetricians and Gynecologists about a year and a half ago looked at all the studies of people who have vaginal estrogen, local estrogen, and they found that taking estrogen, if nothing else is working, and you can't use alternative products that can get moisture to the vagina, if nothing else is working, taking local estrogen does not increase either the risk of death or recurrence in women with estrogen receptor positive breast cancer. That's very, very, very important. Okay. There's another point I want to make about breast cancer. I see a lot of patients that have the so-called breast cancer gene, the BRCA or breast cancer gene. These women are often going to have their breasts removed, and they're often going to have their ovaries and tubes removed at around age 35. This is done because they want to lower their risk of breast cancer or ovarian cancer, which is overrepresented quite a bit in women with the BRCA gene, depending on if you have BRCA1 or BRCA2. Okay. What has been found more recently, and when I talk about this in my book and what to do and how to go about it, is that if you have the BRCA gene and you have your ovaries removed, the data suggests that taking hormone replacement therapy does not increase your risk of breast cancer any more than it was without having the BRCA gene. In other words, it's just whatever issue BRCA brings to the table doesn't change because you take estrogen. It doesn't increase your risk of breast cancer any more than just having the gene. So that's very important because women really need to know that they are not going to be thrown into menopause at age 35 or 38 or whatever age it is. Usually it's 40 or below. And that, of course, is early menopause. And it's important to realize that about 5 to 10% of women go into menopause before 45, and about 1 in 100 women go into menopause before age 40, and about 1 in 1,000 women go into menopause before age 30.
Wow.
So menopause is not about age. Menopause is about transition that can happen at any age.